I want to tell you a little bit about our school. School of Nursing and Health Study has a very rich tradition of education, research, clinical care, and service to our local and global community. The University of Miami has the second oldest PhD nursing program. In the state of Florida, we're one of the few programs in the country that partners with a private academic medical center with a public teaching hospital. And working closely with UM's Leonard Miller School of Medicine and the Jackson Health System enables us to provide students with a vast range of clinical experiences, preparing them well for today's challenging clinical environment.
The reason I chose the University of Miami, first and foremost, was the research, the ability to collaborate with the School of Medicine, which is one of the finest programs in the country. The cultural diversity that exists within our community cannot be found anywhere else in the country. In addition, the professors that are here, they know me by name, they know what my goals are, and they continuously look to help me better myself as a nurse. And I can't imagine getting my graduate degree from anywhere else.
In the School of Nursing and Health Studies, we offer a range of program options, both undergraduate and graduate. Our PhD program prepares nurses as nurse scientists so that they are well prepared to do clinical nursing research. Our master's programs prepare nurse practitioners in a variety of specialties, including family nurse practitioner, acute care nurse practitioner, psychiatric mental health, and nurse midwifery, and our very newest program, nurse anesthesia. We have 3 new programs that we are beginning to plan for, and that's in response to a community need. And one of those is an acute care pediatric nurse practitioner, another is neonatal nurse practitioner, and then also a master's specialty in nursing administration. Of course, we offer the BSN. We also have an accelerated option. We also have a graduate entry option with the accelerated program. And we also have an RN to BSN program that's a weekend program, and this allows practicing nurses from the community to come back and to complete the requirements for a BSN.
One of the strengths of the University of Miami is the visionary leadership under President Shalala, as well as the School of Nursing has Nilda Peragallo. She's a national leader in nursing and in nursing research. The program itself is very flexible. It allows for people who are leaders in practice to return to school for doctoral studies. It also has a very acclaimed faculty with a broad range of skills and knowledge. So I think in terms of added value, that certainly will help me prepare for my studies at the doctoral level.
The role of nursing in the future is going to be based on how we practice and what is the evidence and standards for that practice. In order for nursing to compete with the other health disciplines as well as collaborate with them, we have to know the science and the reasons why we do what we do. So in the future, nursing will be able to generate the knowledge that is needed for nursing practice, as well as generate new programs of study that are multidisciplinary. In order for patient care to become better and the quality of care to become better, nursing plays a very important role. In fact, nurses today are the only health professionals, still today, that are trusted by the American public. However, in order for us to keep our trust in the American public, we need to build our research emphasis so that we can understand why we do what we do, when we do it, and provide the science behind what we do.
The University of Miami is different from other nursing schools as it really has invested in technology in its simulation labs. But there are 3 different simulation labs, our full-time staff that work to serve all of our nursing students and the outside community to improve patient safety, improve healthcare outcomes. Many schools, not only throughout the United States, but across the world, call us each day to have us consult to help them build their program modeled after ours. It's much more than just having simulators and mannequins in a bed. It's actually how to integrate them and implement them into your curriculum. It's a whole different framework, a whole different model, and a different way of thinking. We at the University of Miami have developed and tested a new model to improve patient safety and also to improve clinical decision-making and critical thinking of nursing students. So when they go to the clinical setting, they're not experiencing that case that they may encounter for the very first time, but they may have encountered it several times in a simulated learning lab environment.
I'm just very passionate about the simulation. Of course, I like going to the hospitals and getting the clinical experience in the hospital environment, but the simulation is just like it. So in this new building, we're going to be able to take care of 3, 4, or 5 patients, and then we're going to be taking care of patients that are going to be delivering babies. It's going to broaden our scope of practice, and it's going to give us that realistic experience.
One of the reasons that I stayed at the graduate school, University of Miami, was to be part of this simulation and the education that we can bring to students. Another advantage that I found was the clinical variety. As being in a major metropolitan area, I liked the fact that there were so many options that I could do my clinicals in, and that was a big advantage to me.
Our students are exposed to just about any situation that a nurse would find out in the real world. The past 10 years working with communities has certainly helped me appreciate how important it is that our students get exposed to the real world, not only in the hospital, but also in communities. Because we as nurses really make a difference. We can make a difference in people's lives and communities. So the clinical aspect of a student's education, where they go and that they get the best experience, is very important. What I learn in class, what I do in simulation, how does it come together with a real person in a real situation where just about anything can happen? That is what students enjoy about the clinical experiences.
We'll take great care of you.